Suicide is an important cause of death and thus an important public health priority in all countries. But there are large differences in the rates and demographic pattern of suicide across the 6 WHO regions, and even greater differences between the 194 countries that are member states of the WHO. Suicides in low and middle income countries account for over 75% of all global suicides. But most of the research on suicide occurs in high-income countries in North America, Europe, and Australasia. From 2000 to 2012, suicides have decreased by a quarter on a global scale. There are some regions of the world that have had a small increase in suicide rates over this period, such as the Eastern Mediterranean and the African regions, but the overall downward trend occurs in all other regions of the world, in both males and females, and in different age groups. While geography is one factor to consider, the age distribution of suicide is also important. For example, in Southeast Asia, the WHO reports higher rates of suicide in young people 15 to 29 years of age, while in most high-income countries, the rates are higher in people 30 to 49 years of age. Most international researchers and the WHO previously reported that men were 3 times more likely to die by suicide than women. But the new WHO report explains that the global male-to-female suicide ratio is closer to 1.6 to 1 than the previously reported 3 to 1. With all the rapid changes in suicide rates over the past 12 years, some people wonder if the changing rates are related to changes in the prevalence and treatment of mental disorders. The WHO report does not make a definitive statement about this, but it certainly appears that other factors unrelated to mental disorders play a more important role in the pattern and trajectory of suicide rates within a country. If this is true, prevention of suicide may need to expand beyond the traditional steps of improving the recognition and treatment rates of individuals with mental disorders, such as depression or alcohol abuse. Most studies from high-income countries on suicide show that almost all individuals who die by suicide or attempt suicide have a mental illness at the time. But studies from China report that about 30% of those who die by suicide and 60% of those who attempt suicide do not have a mental illness at the time. Non-mental health interventions will be needed to prevent suicide in these suicidal individuals without a mental illness. Another surprising fact is that the most common method of suicide globally is pesticide ingestion, not hanging or firearms. Governments and public health officials should consider means restriction strategies of suicide prevention that aim to reduce suicides by making it harder to gain the means for suicide. An example is a restriction on the sale of the most potent pesticides by the Sri Lankan government, a policy that led to a substantial reduction in the national suicide rate. Another factor to consider is the treatment of attempted suicides. Suicide attempt is the strongest predictor of subsequent death by suicide. So persons who have made suicide attempt are high-risk individuals who need active support and intervention. But the emergency departments of general hospitals in most low and middle-income countries, where suicide attempts are usually treated, do not have the resources needed to provide the social and psychological support these individuals need. The 5 key points to remember about suicide are the following. 1. Over the last decade, suicide rates have decreased substantially in most, but not all regions of the world. 2. There are very big differences in the prevalence and age by gender profile of suicides by region and by country, most of which are probably not due to differences in the prevalence and treatment rates of mental disorders. 3. In most countries, suicide is in the top 3 causes of death for young adults 15 to 29 years of age. 4. Community-level methods to prevent suicides must include restriction of access to the most commonly used methods of suicide and improved support services for individuals who have attempted suicide. And 5. Most research in suicide is conducted in high-income countries, but the relevance of these findings in these countries for suicides in low- and middle-income countries, where 75% of global suicides occur, is unknown.